Welcome to episode 60 of Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're diving into Starling forces, which are the key regulators of capillary exchange and fluid balance. By the end of this episode, you'll understand how hydrostatic and oncotic pressures determine fluid movement, how net filtration pressure dictates filtration and absorption, and how the lymphatic system prevents edema. So let's get started. Capillaries are the primary site of exchange between blood and interstitial fluid. Their thin walls, which are 1 cell thick, allow for efficient movement of gases, nutrients, and waste through diffusion. However, water movement across capillaries is regulated by pressure gradients, which determines whether fluid moves out of or into the capillaries. Starling forces are the pressures that govern fluid movement across capillary walls, and these forces can be classified as either filtration forces, which cause fluid to leave the capillary, or reabsorption forces, which cause fluid to be drawn back into the capillary. So there are two filtration forces and two reabsorption forces. So let's talk about the filtration forces first. Capillary hydrostatic pressure is one of these filtration forces, and it's abbreviated PCAP. This is the pressure exerted by blood against capillary walls. This pressure pushes fluid out of the capillaries and into the interstitial space, and this is highest at the arterial end or the beginning of the capillary. Then there's interstitial oncotic pressure, which is abbreviated PI-IF. This is created by proteins that are in the interstitial space, and these proteins pull fluid out of the capillary. Generally speaking, there are very few proteins in the interstitial space, so this value is usually really low. Then we have our two reabsorption forces, and remember these pull fluid into the capillaries. So first we have capillary oncotic pressure, which is PCAP. So this is created by plasma proteins, such as albumin, that remain in the capillary because they're too big to cross. These proteins pull fluid back into the capillary via osmosis. We refer to this as oncotic pressure because this is the osmotic pressure caused by proteins. As a result of fluid leaving at the arterial side of the capillary, proteins actually become more concentrated at the venous end because of this water loss, and they help draw water back into the capillary. Then there's interstitial hydrostatic pressure. This is the pressure exerted by interstitial fluid on capillary walls, and this pushes fluid back into the capillary. This is usually a very low pressure unless there is excessive fluid accumulation, such as edema. Now, the balance of Starling forces determine whether fluid is filtered or reabsorbed, and this balance is calculated as follows. If net filtration pressure is greater than 0, that means the sum of the filtration forces is greater than the sum of the reabsorption forces, which means filtration is occurring or more fluid is moving out of the capillary. If net filtration pressure is less than 0, this means reabsorption forces are greater than filtration forces, and so fluid is moving back into the capillary. And if net filtration pressure equals 0, that means the filtration forces and the reabsorption forces are equal and opposite, which means there's no net movement of fluid. To be clear, fluid is constantly moving back and forth between the capillary and interstitial space. It's just a matter of which movement is the greatest. As I mentioned before, at the arterial end of the capillary, we have high hydrostatic pressure, which means filtration is taking place because fluid is moving out of the capillary into the interstitial space. However, at the venous end, because fluid has left the capillary, this hydrostatic pressure decreases while oncotic pressure inside the capillary increases, which helps lead to reabsorption. And so fluid moves back into the capillary. If excessive fluid leaves the capillaries and is not fully reabsorbed, the lymphatic system will collect it and return it to the circulation. Lymphatic vessels drain excess interstitial fluid and transport it back to the bloodstream. If the lymphatic system fails or net filtration pressure is too high, edema, which is fluid accumulation in the tissues, occurs. And so some common causes of edema include increased capillary hydrostatic pressure, and this occurs if during heart failure or if there's obstruction in the veins, or decreased capillary oncotic pressure. And this occurs with some liver diseases and protein malnutrition. And finally, lymphatic obstruction. So if there's some sort of infection or cancer or surgery that blocks the lymphatic system, edema can also occur. So let's summarize with 4 key takeaways. Starling forces regulate capillary exchange through hydrostatic and oncotic pressures. Filtration dominates at the arterial end due to high capillary hydrostatic pressure, whereas reabsorption dominates at the venous end due to high capillary oncotic pressure. The lymphatic system works to prevent edema by returning excess interstitial fluid to the circulation. And so that's it for episode 60 of the Pulse of Physiology. I hope this episode has clarified how Starling forces govern fluid exchange and why maintaining this balance is crucial for homeostasis. Come back next time for episode 61, where we'll discuss the functions of the urinary system and how it regulates fluid and electrolyte balance. Until then, keep questioning, keep exploring, and stay curious.